This is the upper cervical flexion rotation test, which helps isolate for C1, C2, hyper or hypomobility. So your patient's going to be supine, and then you're going to passively flex and rotate their head, and then they should be able to rotate 45 degrees each way, and I will demonstrate. So go ahead and support the patient's head and have them scoot back towards you so that their head is hanging off, and then tell them to relax. You're going to support their head with your hip, and then you're going to have them flex slightly, and then you're going to rotate them. And you can go ahead and slide back down. A difference of more than 10 degrees implicates the upper cervical as the issue. Thanks. Okay, so this is for TMJ range of motion testing. You're going to start with mouth opening. So you want to observe to assess the quality of the movements for any deviations and clicking or popping, and then you're going to measure with a ruler that has millimeters. So instruct the patient to open their mouth as much as they can, and then you're just going to measure. And then also while they're opening their mouth, you're going to be looking for any deviations. So a C pattern would be indicative of a capsular pattern or internal derangement, and then an S pattern would be any muscle imbalance or lack of motor control due to hypertonicity of the muscles of mastication. And then normal mouth opening for functional movement is 35 millimeters. Motion you want to measure is lateral deviation. So again, you're going to observe looking at any differences between the middle of the incisors at the top of the teeth and then the middle of the incisors at the bottom of the teeth. Also, again, be sure to assess the quality of the movements for deviations and clicking and popping. So I'll go ahead and do that. So ask the patient to deviate to the right, and then you're going to be measuring the difference, and then to the left. And normal lateral deviation is 8 to 10 millimeters. If there's decreased lateral excursion to one side, it reveals tightness or hypomobility of the contralateral side. This is the craniocervical flexion test. So the patient's going to be supine with her knees bent. The head is going to be kept in neutral, and the cuff is already inflated under her neck to 20 millimeters per mercury. You're going to ask her to tuck her chin down so that the pressure increases to 22. So she'll be holding the measurement so that she can see when the pressure goes up. She's going to hold that position for 10 seconds without using superficial neck muscles, and then she's going to relax. We're going to repeat this test, increasing by 2 increments each time. A normal response would be if the patient's able to hold for the pressure is 26 millimeters for 10 seconds without any compensation. This is the deep neck flexor endurance test. The patient's going to be supine. You're going to instruct them to lift their head 1 inch off the table, tuck their chin, and then you're going to hold them and then let them drop. And then anything more than 10 seconds is clinically relevant. So I'll go ahead and hold the patient's head. I'm going to instruct her to tuck her chin, and then I'm going to slowly let go. And if she's able to hold for more than 10 seconds, it's clinically significant. So these next couple tests are for muscle length testing. You're looking to reproduce the patient's symptoms. You're looking for any asymmetries and the patient's willingness to move. So the first one we're going to do is for the upper traps. The patient's going to be supine. You're going to flex their head, and then you're going to depress the shoulder on the side you're testing. You're going to side bend away, and then you're going to rotate towards this tested side. And then you would test the other side to look for any asymmetries. Okay, so the next muscle link test is for the levator scapulae. So the patient's going to be flexed, and then you're going to depress the shoulder on the side that's being tested. You're going to side bend and rotate away from the tested side. And then again, I would test the other side to look for any asymmetries, reproduction of the patient's symptoms, or their willingness to move. Okay, so the next muscle length test is for the sternocleidomastoid. The patient's going to be supine, and then this one, they're going to be slightly extended first, and then you're going to depress the sternum, and then you're going to side bend away and rotate toward the tested side. And again, I would do the other side to test for any asymmetry, the patient's willingness to move, or their symptoms. Okay, so for the scalings, for the muscle length test, you want the patient to do this themselves so that they're able to control the amount of pull. So for the middle scaling, you're going to have them, for the tested side, their arm is going to be anchored to a table. So they're going to hold that, and then for the middle one, they're just going to side bend towards the same shoulder, and then you're going to ask them to pull. And then again, I would test the other side for looking for any asymmetries. And then for the posterior scaling, you're going to have them still anchored on the table, and then you're going to have them ask them to look down towards their armpit, and then they're going to be compressing as well, pulling that way. And then I would test the other side, looking for any asymmetries. And then lastly, for the anterior scaling, their hand's going to be behind their back for that pull, and then they're going to look up towards the sky and then go ahead and pull back. And then you're going to test the other side, looking for any asymmetries.
So this is a sharp purser test to test the integrity of the transverse ligament, which supports the dent. So the patient's going to be seated, and then you're going to palpate the spinous process of C2, which is the first spinous process you'll find, and then stabilize that area. You're then going to place the web space of your hand on the patient's forehead, place the patient in slight flexion, and then you're going to push posteriorly. And a positive sign for this test is a clunk or any of the 5Ds, so dysphagia, dysarthria, dizziness, a drop attack.
Okay, so these next set of tests are for the integrity of the alar ligament. So the first one is the alar lateral flexion test. So the patient's going to be seated. You're going to go ahead and find the spinous process of C2. That's just going to be the first spinous process you find. You're going to stabilize that area, and then you're going to laterally flex the neck to both directions. And you should feel C2 start to move immediately with the lateral flexion. A positive finding would be excessive movement or failure of C2 to move, and also symptom reproduction. Okay, so the next test is the alar ligament rotation test. So you're going to find C2, that spinous process, stabilize that area, and then you're going to rotate the head until you feel C2 start to move under your fingers. It should move immediately. A positive finding would be if you're able to rotate more than 20 degrees without the movement of C2 or a clunk. Okay, so these next couple tests are for neurological testing if the patient has numbness and tingling or radicular symptoms down their upper extremities. So the first test is the distraction test. The patient's going to be seated. You're going to take the heels of your hands bilaterally and then find the occiput. And then you're going to slowly lift the patient's head up and hold that for 30 seconds. After 30 seconds, you're going to let off slowly, and then a positive sign would be if the patient's symptoms were relieved.
This is the Sperling's test, a provocative test of the nerve root. You're going to go ahead and side bend the patient's head toward the testing side, and then you're going to provide a straight down compression. A positive finding would be a reproduction of the patient's symptoms, so that numbness and tingling down the tested side. And then you're going to repeat the test on the other side to look for any asymmetries or differences in symptoms.
Okay, so this is the Jackson's compression test. The patient's going to be seated. You're going to rotate their head as much as they're comfortable, so she has full range. And then you're going to provide a downward compression. You would test both sides, and a positive would be an increased symptoms when facing the symptomatic side. Okay, so the last neurological test you can do is the shoulder abduction relief test. So for this, the patient's really going to be doing it themselves. They're going to be seated, and then you're going to have the patient bring up the tested side, their arm into abduction above their head, and then they can rest their hand on top. And then a positive sign would be any relief of their symptoms. And then you would test the other side, looking for any differences.
Okay, this is the upper limb tension test for if your patient has radicular symptoms such as numbness and tingling. I'll start with the median nerve. You're going to first start by depressing the shoulder, and then you're going to place the patient in about 90 to 100 degrees of abduction, so you can use your leg to support that. You're going to place the patient in supination, and then while maintaining that depression, you externally rotate the shoulder, You're going to extend the wrist and the fingers, and last, to sensitize, you extend the elbow. If this doesn't provoke the patient's symptoms, you can also have them side bend to the other side, opposite. And positive for this would be numbness and tingling, or the patient. This is the upper limb tension test for the radial nerve. So what you're going to do is have the patient put their thumb in their fingers and make a fist. So the patient's going to do that. You're going to depress the shoulder again. Their abduction is going to be to about 30 degrees, and you're going to pronate the forearm. Then you're going to flex the wrist, and then you're going to end with extension of the elbow. And again, you can sensitize this test by having the patient side bend away again if they are not provoked. And a positive finding would be numbness and tingling in the tested arm. This is the upper limb tension test for the ulnar nerve. So the patient's going to be supine. You're going to depress the shoulder. They're going to be in slight abduction, and then you're going to pronate the forearm. You're going to spread the fingers and extend the wrist. And then lastly, you're going to bend at the elbow, so flex the elbow. And you can sensitize the test by having the patient side bend away if their symptoms are not provoked. And a positive would be if their symptoms were provoked or that numbness and tingling came on. Okay, this is the Lermite sign test for if you suspect a cervical myelopathy in your patient or an upper motor neuron lesion. The patient's going to be in long seated position, and then you're going to flex the neck and have them bend down. And the tested extremity is going to be raised into a straight leg raise. A positive sign would be if the patient felt an electric shock go down the tested extremity. Okay, so these next set of tests are for vascular clearing. The first one is called the Haughton's test. The patient's going to be seated. You're going to ask them to raise their arms to about shoulder height with their palms facing up. And then they're going to close their eyes. You're going to be watching to make sure that their arms stay still and they don't drop. They're going to hold this position for about 10 to 30 seconds. If their arms start to move or drop, this would be a non-vascular issue. So you can go ahead and relax. We're going to repeat this test with the same exact parameters. Her eyes are going to be closed and arms to shoulder height with palms up. But this time, so you can go ahead and do that. This time she's going to be looking over her shoulder, and then it's going to be side bending, extension, and rotation combined. And then you're going to hold it for 10 to 30 seconds. If the arms move now, this would be a positive sign for a vascular issue because that side is now occluded. You would want to repeat for the other side to see any differences. Okay, the next vascular clearing test is the vertebral artery quadrant test. This must be done if you're going to perform any mobilizations or manipulations in the cervical spine. So the patient's going to be seated. They're going to do combined motion of extension, side bending, and rotation. So they're basically going to be looking over their shoulder. And then you're going to ask the patient to keep their eyes open while you observe. They're going to hold it for 30 seconds, and a positive sign would be any of the 5 Ds. So dysarthria, diplopia, dysphagia, a drop attack, or any dizziness. If it's positive, you don't want to do any mobs. So you'd also test both sides to see any differences. Okay, so this is for first rib mobility testing. If you suspect that the first rib is involved in the patient's symptoms. So the patient's going to be supine, and then you're going to palpate bilaterally just posterior to the clavicle to find that first rib. You're going to ask the patient to take a deep breath in and a deep breath out. And then you're going to look and palpate for any asymmetry, and then also you're going to have the patient side bend to one side. So we'll go to the right first. You're going to be palpating the opposite side. The first rib should be coming up. And then a positive sign for this is any asymmetry or reproduction of the patient's complaints. Okay, so these next set of tests are for thoracic outlet testing. So the first one is called Adson's vascular test. The patient's going to be seated, and then you're going to find their radial pulse on the tested side. Then you're going to place them in slight abduction, externally rotate them, and slight extension. And then you're going to have the patient turn their head towards the elevated arm, and then you're going to ask them to take a deep breath in, hold it, and a positive sign would be if their pulse was diminished. And you would test the other side for comparison. Okay, this next test is the costoclavicular test. The patient's still going to be seated. You're going to, again, find the patient's radial pulse. I could have that. And then you're going to be placing them in more abduction, more external rotation, and more extension. And again, that positive finding would be if their pulse was diminished. This one is specifically looking at impingement at the costoclavicular region here. Okay, so the Ruse test is good for neurological or vascular dysfunction. So the patient's going to be seated again. You're going to ask them to bring their arms up like a goalpost like this. And then they're going to open and close their hands for 3 minutes. And a positive finding after the 3 minutes for vascular would be any blanching or temperature change, so cooling of their hands. And then neurologically, if they have any numbness and tingling, those would be positive findings. The right test, the patient is going to be seated. You're going to raise their tested arm into 100 degrees of abduction and then externally rotate their arm. And then you're going to palpate the radial pulse, and a positive finding would be if their pulse was diminished. Okay, so the shoulder girdle passive elevation test, the patient needs to have their symptoms because this is a relief test. The patient's going to be seated. You're going to ask them to cross their arms across their chest, and then you're going to passively shrug the shoulders up for 30 seconds, putting the thoracic outlet on slack, and then any positive sign would be if their symptoms were relieved. Okay, so educating the patient resting position of the tongue. You want their tongue to be at the roof of their mouth where those ridges sit, and there should be free space between the top and the bottom teeth, and they should not be touching. And to cue the patient, like if they can't find the position, you can ask them to say no, or make a clicking noise like this. And wherever their tongue sits is the resting position of the tongue. And then you can remind them to check this position every hour.